Okay, so this is Hader Institute Certificate for CHCAOD006, not 007, 006. It's nearly as good. Provide interventions for people with alcohol and other drugs issues. So, and I'm Dwayne. So with that, we'll kick off with the acknowledgement of country. In the spirit of reconciliation, Haida Institute of Education acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We recognise Aboriginal and Torres Strait Islander people as the first inhabitants of this nation and the traditional custodians of the land on which we work, live, and study. We express our gratitude for the sharing of this land, our sorrow for the personal, spiritual, and cultural costs of that sharing, and hope that we may move forward together in harmony and in the spirit of healing. We pay our respect to all First Nation people and acknowledge elders past, present, and emerging. Well, that rather than just reading that and skipping on, is anybody Indigenous? Is anybody here? Oh, Mark. Okay. Because I didn't want to necessarily read it and skip on. I was wanting to. I was hoping that somebody here would be able to read it or say it, or if they were not Pommy, then you could do the welcome to country rather than the acknowledgement of country. Sometime maybe. If that's all right, Mark. What do you reckon to that, Mark?
Yeah, no worries. Yeah, welcome. Welcome to this beautiful country we have. Yeah.
Thanks. Did you hear the bus coming and I threw you under it?
Yeah. No, I heard you. I was just having a few technical issues, you know.
Oh, good. Yeah.
Yeah. No, yeah, we recognise the reconciliation, you know, and
yeah.
as mainly, you know, I am partially Indigenous, but doesn't, you know, I've still got the same respects as what a full Indigenous, you know. There are some pretty, there's not as many full bloods left, you know, but there are some people that would look at me where I'm from that would say, no, you're just a white man. So, but that, yeah, no, all respects to them. You know, we show our gratitude to sharing the land, our sorrow and our personal, spiritual, cultural costs that sharing that, and hope that we'll be able to move forward together in harmony and in a spiritual way of healing.
Yeah.
Yeah.
Cheers, Mark. Thanks.
All right.
Thank you. So, first of all, we'll do a bit of housekeeping. Just you might have heard it before, but this is just way we work. Cameras on. If you're in the room, please cameras on so we can interact to the best. Microphones off as well, or microphones on mute, microphones off. Please remember to keep your microphone on mute unless you need to ask a question. If asking a question, that's the middle class participation. Put your hand up and use the emoticon or whatever it's called. Class breaks should be fine at 7 and 8, should be perfect. Respectful relationships, be mindful and kind with your words and respect the opinions of others. We're all learners and in this together. It's true. And no smoking or vaping on camera, please, or alcohol either. We wouldn't be doing it if it was a classroom and we're all in the classroom. So it's just the same. We wouldn't want to trigger each other either. With that, trigger warnings, not just the physical things, but emotional triggers as well. Just respect our relationships and be careful about your words and if it's a sensitive subject or you might be talking about something sensitive, just be aware to maybe check that somebody in the room might have an issue with it. So not necessarily stay quiet, but just be aware with what you're saying. And finally, be kind to yourself. After this, look after yourself. Be kind to yourself. Make time for other activities as well. It's only 9 o'clock when we finish, so there's plenty of time to have a bath, watch some TV, chill out, relax. Uh, the main thing is the legislative requirements in AOD. That's a lot of what we're talking about. Um, Providing interventions for people with alcohol and other drugs issue. An intervention is when somebody's going on along a road and you manage to get in front of them and sometimes startle them, or they might be shocked when they see you because you've got in front of them and got an intervention. That sometimes that is the way it works, where somebody's come along to help somebody and it sort of knocks them off balance and there's a bit of a shock there. Other times, the client is wanting an intervention. So sometimes an intervention can come somebody's way and helps them out. But at other times, the intervention is sought out by the client and you go looking for it and you might not find the first one might not be the best one. So you look for another one and then another one. And then eventually you've got something that works. So by the end of this session, you will understand legislation in AOD, legal principles and requirements, and duty of care. Other relevant state, territory, AOD legislation. So there's the law, obviously, the legislation, but then there's the way we work it out. It's almost like the policies and procedures that we talked about in an office a few weeks ago. So the government has designed the policy, which is here. If I'm in New South Wales, so it's the Drug and Alcohol Treatment Act 2007. The government doesn't tell us how to put that in practice. There's a lot of detail in there about what is allowed and what isn't allowed, but it doesn't tell us how that's going to get worked out. All of that stuff is all left to agencies, charities, services, you, me, all of us trying to make it work. Same in other territories. Their acts are very similar. So harm minimization. That's when the government puts the act in. So the government has given all of the states and territories these acts and these policies. The way it's worked out, the way we do it, is with harm minimization. So we're trying to minimize the harm. I guess for a long time, it was sobriety. That was instead of it trying to be the end goal of some people, sobriety, like stop doing it, was the way it was done as well, which almost seems weird. Like if a tiny child is learning to walk is the end goal. It's not the teaching step. You don't drag them up onto their feet and say, come on, walk, walk, walk. And that was almost what sobriety was meant to be doing with AOD issues. So you're drinking too much or you're using way too much heroin. Well, stop. Just give up. That's it. There isn't an in between. And with harm minimization, people started to realize actually we can't just make people walk before they can walk. We've got to take steps, one step at a time. And that's pretty much harm minimization. And that's split up into a few things, a few ways. So that is these are examples of how harm minimization works. So rather than just stop, we've got reduce demand, for AOD and or reduce harm they cause, needle exchanges, safe injecting spaces. All of these are quite contentious, I guess, for the people out there that just don't understand AOD issues and are still in that idea of just stop. All of these harm minimization methods are all very, very, they seem crazy because there's still that idea of you're using too much heroin, well, stop, just don't do it. So working to reduce harm associated with substance abuse. Instead of prohibiting use of harmful substances, we mentioned that last week, instead of prohibiting it, reduce the harm. Pill testing is harm reduction, harm minimization, sorry. Pill testing is harm minimization. Where maybe the police are standing there waiting, saying they shouldn't be allowed in here. The pills should not be allowed. People shouldn't be bringing them in. People shouldn't be taking these pills. Well, that's great, but they're coming in and they're very, very dangerous. So what are we going to do about it? That's the main thing. So kicking off with a video, short video. I'm going to put it in the chat because it might not work on my screen. Here we go. It's only 2.5 minutes long or something. So, click on the link that I put in the chat. And then it's 6:13 now. So 6:15, we'll jump back in here. Some of the funniest ads are gambling ads. They're hilarious, some of them. And I can see, like, you can see how a young bloke is going to get hooked in so easily.
Oh, well,
Definitely.
I actually went to a pub once and they had like a combined TAB, and the guy was betting on, like, he was over 18, but he was betting on virtual greyhounds, which that actually blew my mind. I never knew there was such a thing, but virtual greyhounds and virtual horses. And I'm like, that doesn't sit right, but whatever. But it is just as damaging, I think, as, drugs or alcohol, financially and, emotionally in the family and, to people's own mental health when they gamble. So.
Yeah, it's interesting. Two guys at work, they love sport and they love gambling, but they are genuinely against all the ads, but against all the advertising. So it'd be interesting to see what kind of a kickback from the sports community and from supporters and viewers, what kind of reaction there would be. Like, would everybody be up for it? That's the who knows. And so Chris has mentioned with AOD, alcohol and other drugs, any addiction is really brought into that. We're looking at gambling, we're looking at like there's sex addiction, there's food is brought into that. So you could genuinely go to some rehabs. There's a really posh one in on the eastern Sydney, near the South Pacific. It's called South Pacific Private. They got all sorts of addiction there, and it's not just alcohol and other drugs. It's like addiction rehab for a month, and a lot of people get it from private health insurance. That's where people would go that have got the money to pay for it as well. So I'm not going to say it's a holiday camp because rehab is a place to get healthy, but especially because I'm recording as well. So, back to the slides. So with harm reduction, harm minimization, sorry, and I always say the wrong one. With harm minimization, there's the different strands of it. Has anybody heard of harm minimization before? Like, what is it that you've heard? Do you know what it is? Do you think it's helpful? So I saw somebody's. Yes, Colin, go for it.
Yes, I went to a meeting with one of our crew, and they were dealing with children who had addictions and that, and the harm minimization, where you can't cure what's happening with them and all their issues. It's a way of dealing with minimizing their addiction at the time, or what's happening at the time, giving them trying to bring them back a little bit further back on the track. It's where you can't stop something from happening. You can certainly guide them and try and help them to deal with what they're dealing with, and minimize as much as you can. Because some things are addictions, and some other things cannot be cured. So you do go through an exercise of seeing what you can substitute for other things, and how they can minimize the exposure to some other elements.
Yeah. Who did you say, was that at work or something?
Yes, it was. It was. We had someone come in with I can't remember what the foundation was, but they were visiting. That's where the parents of a child had lost a child through addiction,
Right. Yeah.
and they came along, and they had a program that helped to try and minimize harm. They're saying, well, we can't stop them from drinking or smoking or sex addiction, and those sorts of things, but you can look for alternatives, and it helps you to cope with what's happening, and it helps you to try and assist them if they want to stop. Well, you can't stop them from doing it, but you can certainly give them alternatives, or try and abate some of the behaviors they get from the addictions and things like that.
Yeah.
So, yeah.
When you say you can't stop people from doing it, they've done harm minimization with all sorts of other things. They've obviously done it with pill testing. People are going to take these pills, so we've got to make sure that they're safe to take, even though they're illegal. With a teenage pregnancy, and STIs. So with sexually transmitted infections, people are going to have sex, so let's give them free contraception. Which there were at first, the HIV thing was just don't have sex, because it's dangerous with many people. And then when the harm minimization ethos came round, then it was realized, okay, we can't stop that, so we'll give free contraception. And then with teenage pregnancies, there was a hard line of don't be having sex outside of a committed relationship, or don't do it for leisure with many people. And then it was realized, actually, we can't control young people, so we'll give them free contraception. They don't need to pay for it. They can come and get it, instead of getting embarrassed and going into a pharmacy and asking for contraception. We'll break down the barriers of shame and guilt and help them along, and make sure we get it to them rather than them coming to find it. So that was all harm minimization. Luke, you've got your hand up. Sorry, go for it.
I was just going to add that it's that balance of recognizing the dignity of risk the balance between dignity of risk and duty of care.
Yeah.
And I think if we look under the banner of harm minimisation, if we're open to it, it really isn't restrictive, because we can think of working with someone who's in the throes of whatever their addiction is on one end of the scale, and then there's all this stuff in between, and at the other end of the scale is someone that's looking at maybe being totally abstinent from all their addictions. And so the scope is in between those extremes. So there's this sort of wide berth in which to work with people in, and recognizing their dignity of risk and balancing it with our duty of care to help minimize the impact not only on the individual, but the people around them and the community at large.
Yeah. And when you say the dignity of risk, that for people that don't use heroin, their duty of care is that, well, stop doing it. Harm minimization is stop it. Just stop, get rid of the heroin, get it off the streets. The harm is the using. And we're not, as agencies and services, we're not there to say what you're doing is harmful. It's the client that says what the harm is. So if somebody is happy to smoke 20 cigarettes a day, then, and they're not calling that harmful, even though it has been shown that it is. And if they haven't got any problems with that, then we're not here to say what you're doing is harmful. That's not what we're meant to be doing. We're meant to speak to a client. They say that there's a harm that they're undergoing, and then looking at the three things on the screen, we're meant to tackle what they're saying, and maybe reduce the supply or reduce the demand for it or reduce the harm. So that's all caught up in harm minimization. Go on, Mem.
Yeah, just to add to that, Hep C was a big problem with the IV users, and they had needle exchange centers. And on top of that, when the needle exchange centers were closed, there was actually 24-hour mobile units that you could also ring as well, where they'll drive to you, mostly in the CBD. And that was a harm minimization towards the hospitals and, doctor visits. And, it was a big burden, like Hep C, especially during the AIDS days as well. There was a lot of needle sharing, I should say. So that's what they came up with for harm minimization for that.
There's a lot of the methods that are taken for harm minimization, the hardline conservatives are going to say that, well, that just encourages the behavior. So if you're given free contraception to prevent STIs going through the community, then the hardliners are going to say, well, you're just encouraging the behavior that you're not wanting. If you're doing a pill testing, you're encouraging people to take the pills. If you're doing a needle exchange, then you're encouraging the using of the heroin. But whether that's true or not, it's a massive argument. But whether it's true or not, when you do needle exchanges and when you do pill testing, people are safer and less people die. So, okay, fair enough. The hardliners have their point that they want to shout about. But it will kill people by taking that line. More people will die, unfortunately. So going back to this, yeah, so with the harm minimization, you can look at them three, and you've probably any adult that lives in Australia can see how these are done. every few weeks, supply reduction. Every few weeks, we'll hear on the news that there's been another intake of cocaine, ice, heroin, pot, or something, whether it's been strapped to a boat in the harbour and the police or the customs have found it. There's always some story that there's another load being found. So the police, the customs officers, they're all trying to reduce the supply. Hopefully they're having a big impact, but it's not the only thing. If we relied solely on supply reduction, it wouldn't get done. It wouldn't happen. It gets through, unfortunately. Demand reduction. So that's all sorts of programs to help people that are experiencing issues to help get them off the substance. Could be rehab, could be detox, could be self-help programs like home detox enabling and things like that, to get people off the thing that they're having problems with. And then harm reduction. Okay, it's got through. The substance has got through. It's in the country. People are using it. Well, let's make it less harmful. If people are going to use it because it's here, then let's reduce the harm in it. And all of them three together is the harm minimization strategy. So, is it still recording? Yes, it is. All right. You can tell, can you, ma'am? That's good. Thanks. So other legislation, mental health, these are all linked. So when we talk about things linked with substance abuse, obviously mental health is an issue. Obviously, children being self is a big issue as well, and children in the workplace as well. All of these things are linked, so there's legislation around it, which is good. So we're going to have a bit of research in a minute. National Principles for Child Safe Organizations. So if you want to work with children, then you have to get a working with children's check. It's called all sorts of different things in other countries, not in other countries, in other states and territories. It's sometimes called a vulnerable people check, which doesn't just, in New South Wales, it's a working with children's check, but it will cover you for working with like aged care, disability, and other vulnerable people. And in other states, it's called a vulnerable people check, which covers everybody and children included in the middle of that. So with more legislation, we've got anti-discrimination legislation. So it's not about keeping recovery for a certain type of people, certain skin color, certain culture. It's opening it up for everyone. So we've got cultural considerations of cultural safety, and then workplace health and safety, normal, standard. I'm sure everybody knows all about that. So legal principles and legal requirements. The whole thing is based on human rights. So the government is fully aware when they're writing the legislation that everything we do is, as services and agencies, charities, AOD sector, it's all based on human rights, which brings in that both of what Luke said, the dignity of risk and the duty of care, because we have a duty of care to every human because they have a right to healthcare and not not being victimized and not being in danger of their life or anything like that, all the other human rights. But also they have a right to choose if they want to carry on using something. Alexis, yeah.
Hi, is this sort of we covered, like, it was like the first lecture we had, wasn't it? We covered the whole legal requirements, our care of duty and stuff like that.
Yeah, that's right. That well done for remembering. You distracted me with that drill. Why have you got a drill? Why? What's the drill for?
I'm doing opals. I've been doing opals for the last couple of weeks. So yeah.
Oh, cool.
Yeah, I've got some really nice ones. So I'm just buffing them up. I'm watching my lecture. Yeah.
Fair enough.
But no, I just wanted to know if that's what we're going on about, because I've sort of I don't want to be too far behind, but I'm still like half of a lecture behind. So I'm just making sure that I'm keeping up with it, and make sure that you're just covering what we spoke about in the first lecture. That's all.
Yeah.
Or
So based on human rights.
Yeah.
All good.
Thanks.
So the legal principles and legal requirements: disadvantage, discrimination, devaluation, and rights ignored or violated. So simply, in some people's minds, because I drink too much alcohol, that means I'm less of a person and I lose my human rights. That doesn't work like that. Or even take it a different way. Because I take heroin and I've taken it so much that I've had successive overdoses, then I lose my human rights to healthcare and support and ambulances. That's not true. No matter what I drink, no matter what I use, I'm still a human and I'm entitled to these things that the human rights tell me that I'm allowed to, no matter what happens. And that's the Australian Human Rights Commission have also supported that, backed that up, and that's where we're getting the issues. That's where we're getting the decisions from. So this is a 5-minute video. So let me just pause the recording. Oh, okay, so with human rights, it's a massive minefield, because if it's my right to take heroin, to use heroin whenever I want to, and it's my right to have harm minimization strategies in place, and healthcare, including a needle exchange program. Where is the government going to put a needle exchange program where everybody else's rights aren't at risk? Like, there's certain places you cannot put a needle exchange program. Anywhere that's going to cause the greatest risk of harm to other people, like a city centre, shopping centre. It's going to be problematic there. I have seen some in a shopping centre, like a Westfield, but they're not right in the middle of the hub of the shopping centre. So human rights, it's human rights for everybody. And it's balancing everybody's human rights. It's not just balancing the duty of care and the dignity of risk. It's balancing everybody's duty of care to the young people that are around, to the people that don't want to be affected by it. You're now not allowed to smoke in public places at all, because it might be my dignity of risk to smoke cigarettes, and I enjoy them. I'm happy to embrace my dignity of risk, but I'm not allowed to put anybody else at risk. I'm legally not allowed to put anybody else at risk with the cigarette smoke that I might be smoking. So it's a balancing act of dignity, duty, and human rights. And hopefully the government gets it right. And if it's weighted in too much on one side, then it's going to be a problem. But hopefully they get it right. What time are we on? 6:50. Okay. So moving on, we've got, yes, ma'am, go for it.
Yeah, it's just interesting how you said hopefully the government gets it right. Where I'm confused, living in Melbourne, we have a suburb called Box Hill, so the whole municipality is a dry zone. So you can't buy any alcohol there at all. There's no pubs. And that was due to, I think, World War II veterans coming back, and that's where they placed them all to build a suburb, and they weren't allowed to drink. And that law still exists today. So where's the human rights of the
Wow,
people that live in Box Hill?
I didn't know that. Sorry, so inbox, you're allowed, what can you do? Like, sorry, in a lot of CBD areas, you're not allowed to drink in public. You're not allowed to carry alcohol. I don't know how it's meant to get to the car, but you just can't drink in public. But in Box Hill, what is the difference?
Well, the dry zone is there's a perimeter. There's no pubs in that perimeter. There's no bottle shops.
Right.
And there are restaurants within that area that aren't allowed to sell. I think they're not allowed to sell, but that you can bring your own. So yeah, it's just really, really dicey in that municipality that, where's your human rights? If I lived in Box Hill and I was a drinker, I'd be pissed off like that. I'd have to go to the next suburb to buy alcohol, So
Yeah,
it's just confusing. That's all.
yeah. Alexis, yeah.
Yeah, I used to live in a place called Haberfield in Sydney, and the whole place is heritage listed, and they've only got a cellar there, and it's like the only suburb in the whole of Sydney that literally doesn't have a pub, and I thought that was pretty crazy. So
It's the
yeah.
Sorry, I missed that. The only suburb in Sydney that what? Sorry.
It doesn't have a pub. It doesn't have a pub at all. It's just got one. It's got one wine cellar, but and that's it. But it's pretty much the only one that doesn't have any sort of bar or pub there in the city of Sydney. Yeah. So, but the whole area is heritage listed, so it obviously runs on the heritage laws as well. In that sense,
Right.
I'm guessing.
Yeah, definitely. There'll be a few different laws trying like tying people's hands there.
Yeah, and it made a massive difference. I remember, like, living in Sydney as a teenager. I'm in Adelaide now, but living in Sydney as a teenager, just it doesn't matter what time you walk out your door. It was always, but like here in Adelaide, like the bottle shops close at 5, and the pubs all close at. I'm in Strathalbyn, and everything's closed by 12, sometimes 11. And then there it's like bottle shops close at 12, and all the pubs are open till 5, 6 in the morning.
Wow.
So I guess I chose to live in a place where there was, because I've never been a drinker. I don't drink, but I've been around a lot of alcoholics in my time. So it's sort of it matters a lot to me to be in a place where I'm not going to walk out with my child and there's going to be people drunk falling over themselves, and it makes a massive difference. It really does.
Yeah, definitely. Oh, yes, Mark, go for it.
Yeah, it's pretty, where I'm from, Alice Springs, Tennant Creek area. It's pretty out of control. I mean, we've got the pubs. The pubs are open for a certain amount of time during the day to let locals in, mainly Indigenous. They sort of use they minimise a lot by having those hours in the pub, and then they let them all go and along their way to sort of give them some sort of freedom. But it's pretty much straightforward. It's out of control there. So a lot of drunks on the streets, and if it was open for a normal time like it is in here in Queensland, it'd be just horrendous. A lot more violence, a lot more robbing, and steal, thieving and that. But yeah, I totally understand. Yeah, it's pretty dismal when I did. I don't drink much anymore, but it was pretty dismal when you couldn't get a drink. But yeah, it's unfortunately the majority that's there. It needs to be contained, and yeah.
Yeah, definitely. Go for it, Alexis. Sorry, yeah.
Yeah, I was going to say, I just met a man in the town that I'm living in. He's still an alcoholic, but he drinks. He's got it under control in a sense. But he was from Alice Springs, and he was telling me he gets the news feed, and he's always telling me on how bad it really is up there from their Facebook news feeds. But he's telling me he was really bad at one stage. He actually went into Centrelink. He's on pension now for being an alcoholic. And he went into Centrelink and he literally pulled out a bottle of methylated spirits and started drinking it. And they just gave him the pension for being an alcoholic. For drinking methylated, that's all he had to do was go in there and start drinking methylated spirits in front of them all. And I was just like, there's got to be something wrong here. The government's just now that guy's for the rest of his life.
So the legal principles and legal requirements with the duty of care, the obligation or the duty, it's almost as if because of the right of the client, because of the human rights of the client, there's an obligation or a duty from the service provider, and that goes like meshed hand in hand. The client has rights, which means the service provider has an obligation to help. So avoid causing foreseeable harm through actions. Dignity of risk, that's the contrast of it. I already mentioned it, obviously. The right to make our own choices. A lot of this, I can't remember whether it was your class, but this is linked in the courses when all the Cert IV courses, dignity of risk is mentioned a lot. Oh, it was your class because it was Mem that mentioned that it was for aged care. Yes, that's right. Takes me a while for things to click. So reasonable risk. Everybody has a right to their own choices and a right to refuse medication or refuse healthcare if wanted. Learning through the consequences of our actions is quite often preferred, but it takes a lot longer. So the guidelines for balance and duty and risk. So like I said, it's a very difficult balance. The capacity, skills, knowledge, frame of mind, and past experience of the client. The job role description or duty statement. The boundaries of your own role. And then in the services, refer to code of ethics, practice, and standards, and then consult with others. So we're going to leave it there, ready for break time, because the next thing is case study. So, yeah, leave it there. We'll come back at 7:10. Looking at can you see the learner guide on the screen? Yeah, okay. So this is where we are at the moment. This is page 19. Duty of care and dignity of risk. This is, if you miss anything, if you don't understand anything, if there's any issues that you just haven't got a clue what I'm on about or what other people are on about, sometimes it's good just to go to the learner guide and have a look at what that's saying. So this is where we are at the moment. It's saying on here, In all aspects of your work, it is important to be aware of and support human rights. Many clients, including clients of AOD services, experienced disadvantage, discrimination, or devaluation, and having their rights ignored or violated. The Australian Human Rights Commission's role is to uphold human rights in Australia and to provide an avenue for complaints about breaches of human rights, which is important. Where we see that human rights have been broken at certain times, certain legislation, certain governments say, because you've done this, you're now not privileged to certain human rights. Well, that's not quite true. There's nothing that we can do that makes us lose our human rights, according to the Human Rights Commission. People might do some horrible things, and we might, or many people might, think that they don't deserve certain human rights, but the Human Rights Commission disagrees and says, no matter what's happened, you still deserve human rights. Even if you go to jail for a long, long time, there's certain human rights that you're still allowed in jail. So even in the US, there's the argument of capital punishment, where if you've done something really bad and you're going to get put to death, then you're still allowed human rights, and it's not meant to be torturous. It's not meant to it's not meant to be painful. And that's a big argument over there. So on the screen, this section about dignity of risk and duty of care, there's a case study in here. Yeah, this is it, the big pink section. I'll leave it on screen instead of you going to find it first. And I'll try and zoom in. No, that didn't work. That's better. Okay, so have a read of that, and then I don't think we need to go to breakout rooms. I think this will be fine just individually. We'll come back at 7:30. That'll work. And have some answers to the questions at the bottom. And we'll discuss them then. Just checking that there's no more questions underneath. Yeah, that's all right. So have a read through that. I'll leave it on the screen. And then we'll come back in 14 minutes. Is the case study. Everybody needs an answer for the 4 questions, but you don't all have to give the answer. So we'll start with the first one. What do you think Jane's duty of care is towards Muella? So Jane's the counsellor, and Muella is the 17-year-old client. What's Jane's duty of care? Anyone? Alexis is putting a blanket on and it's making me cold. Yeah, go for it. Yeah.
Well, me? Okay. I really wasn't too sure, but I'm guessing under the circumstances, it would be to tell the authorities. But I don't know. I really don't know, because if she's going to a party with and she's already stated that there's going to be illegal drug use and that she's already suicidal, and there's going to be at a party where there's people bullying her, so she's got, like, you know, so many risk factors being raped, OD, suicided. You know what I mean? So I think that the health, I don't know, but I could be wrong. I don't like, it's a hard one, that one, but in her duty of care, it might be under the circumstances would be to tell the authorities where the party is. Yeah, unfortunately.
Okay. Anyone else? Mem? Yeah.
Yeah, I'll just keep it really simple with this one. I just noticed that she's a recent worker, so she might not be up to scratch with policy and procedures. So one step might be to ask her supervisors what the next step is regarding her first Moella. Yeah, I'll just leave it at that.
Yeah, that's a good idea. Yeah. Anyone else? Were you going to go again, Alexis? Or, let's go on to the next question then. What? Oh, go on, Colin. Yeah, go for it.
Sorry, I was just going to say her duty of care to her is to ensure that she's as safe as she possibly can be. She can't stop her from going to this party, but I'd say if she's probably done what she has to do. She's talked to her about the impacts of the drugs on her mentally and physically, particularly with mental illness. She's spoken to her about other counselling. She's addressed some of the other matters. She can't, because of her dignity of risk, she can make those choices to go to these parties, but it'd probably be counselling her not to. I don't think there's enough in the scenario to say that she actually has told anyone exactly where this party is, and I'm assuming in this case, in a lot of these circumstances, they're not going to say what's happening, but she has put a scenario out there that there may be some dangers. Certainly, she wants to protect her, but of course, she's got to allow her to make her own mistakes as well. That's all I can say.
Yeah. Some great answers. I think it's connected with harm minimization, but safety plans are really, really important. So, for instance, okay, she's not going to be able to stop her going to the party. That's the major point. So, like Alexa said, you could tell the authorities, or if you can't stop her going to the party, and that is potentially going to be harmful, then you could help her draw up a safety plan with contact numbers, with at what point she's going to be able to leave, or at what point she would be willing to leave. What would happen to say, I need to get out of here? And just walk her through, yes, an exit plan, exit strategy. It would be really unprofessional for any of us as workers to say, here's my number, call me, text me, if you're feeling scared, freaked out or anything. It's up to us to help her find somebody in her life that she can do that with. So she might have a sister, she might have a best friend, she might have an auntie. It might not be her mum. She might have the caseworker or the counselor might have actually said, text me anytime that you're feeling threatened. There's even Lifeline and telephone numbers like that. In this exit strategy, this safety plan, just getting her to realize there will be a point where she's going to be wanting to go home. What point will that be? And if she walks into the party and doesn't have the exit strategy safety plan in place and has never even considered it, she's going to go beyond this point of safety very, very easily. And it's just going to appear and she's going to walk past it. But if she's already got this plan in place in her head, as she gets closer and closer and closer to the point where it's not going to be safe anymore, she's going to see it. She's going to feel it coming, and she's going to be able to. She's going to be more ready in herself to say, "Okay, I'm going to pop to the bathroom because I'm feeling a little bit uncomfortable, and I'm going to text my sister." So things like that. Yes, Nicole.
I found just sort of along those lines as well with the craft assessment. Part of that, they actually have a thing called a contract for life, and it was designed by Students Against Destructive Decisions, which it's pretty much just a agreement that the young person will never get in a vehicle when they suspect that the driver is under the influence of drugs or alcohol. So maybe that's something else with the exit plan that she could talk to her about.
Yeah, yeah. There's so pointing out. We can point out the harm in the party till we're blue in the face, but it's not going to work. So if we point out to her some of the harms in the party that she might face, that might be there, she's drank alcohol before. She has some sort of recognition of what it does to her body. She has some sort of recognition of how much she can use. Pot as well. She's smoked it before. She knows what it does. So there's them other harms as well that she might not have considered getting into somebody's car for a lift home when she's actually had too much. So options and things to do then, instead of getting into somebody's car. With safety plans, Nicole, I thought you were going to mention about if she was suicidal. There's safety with harm minimization. We can't stop somebody feeling suicidal. We can't take that thought out of their head, but we can draw up a safety plan and say, okay, when you're feeling like this, who are you going to call? When you're feeling like this, what are you going to tell yourself? Where you're going to go? What is it that you're going to do in this? And it's a safety plan again. It's an exit strategy to get out of that stressful mode of thought. Really, yes, Lisa.
Could you make a follow-up appointment with her for like the next day, so that you can check in on her and still support her?
It's a great idea. Yeah, that'd be fresh in her mind. If you've some people are under the pump and they might not have any more appointments until the week after, but maybe a telephone call, like next day would be still fresh in her mind to do a bit of a debrief and obviously check she's okay, but also to say, okay, where were the harms there then, and what was the big risks that you were walking into? That'd be a great thing to do. Yeah.
Yeah, and then like if she doesn't answer the phone, go to your supervisor to see what would be the next step to take.
Yeah. Yeah, because obviously there could be problems. Yes, Mark.
They try and involve the family a lot more for support systems. Involve family. Yes, especially with if she's going out and all that, getting on it. She's best to sort of, and if she does get along with the system, maybe try and encourage a bit of family support.
Can anybody answer? Sorry, how do you get family involved with somebody with confidentiality is important?
That's what I thought as well.
How do you get Lisa, you got the golden ticket?
You'd have to get her consent first.
Yeah.
And it says in the case notes that she doesn't want her mother to find out. So you're probably not going to get consent to tell by the notes anybody in the family. because it doesn't say who she gets along with.
Yeah, yeah. That can be a problem. Okay, next question. Pretty random, pretty vague, but we've all got an opinion, I guess. What factors do you think might be contributing to Moella's self-harming and drug use? Nicole, yeah.
I just wrote down a few things. I had the bullying at school. It sounds like she's got quite a bit of home pressure as well of her family hoping she's going to go to university, caring for her siblings, the housework, and a part-time job. And it's hard being a teenage girl just in general, with pressures of, hormones and social media and all that sort of stuff. It sort of sounds like she doesn't have a lot of time for herself to look after like her mental and spiritual health. So
yeah, true.
I feel like that's possibly a factor.
Definitely, yeah. Mem? Were you going to say something, Mem?
Sorry, mute might help.
Right.
I wholeheartedly agree with Nicole with the points that she raised. The only thing I could come up with, and I don't know how much validity there is to it, is she comes from a third world country and there might be some repressed memory as a child that's linked into it that comes up later. There has been studies prove that, those memories can come up at any age. So that's all I got to add to what Nicole said.
Yeah. And Alexis?
I personally think that it doesn't have anything to do with maybe, well, it might have something to do, but a lot of family life and is passed down generation to generation. So that doesn't seem to be something that gets teenagers into a depression state. It 100%. I'd think that it'd be the bullying, online bullying, that would be doing it. Personally,
yeah, there's going to be a lot of things there
from the past history. I think we all were like, as I said, the generation passed down our, the way the family works when it's sort of, people just get on with it. But the online bullying would definitely play a factor. She'd probably be more sensitive to it because she is a bit stressed because of the home life. But yeah, it would have definitely pushed her over the edge with the online bullying. Definitely, I think.
Okay. Risks for Moella, I think we went over that. So, any conclusive answers? What do you think Jane should do? And why? Yeah. Ma'am, yeah.
Unmute this time. By law, bullying is against the law anyway, so she has to report that if it's at school and make some sort of authorities aware of it. And also the fact that there's drug dealings going on, that's against the law as well. So you need to get the police involved in that. And that's not necessarily going against client privilege, it's more of a school issue. So it's not just affecting Moella, it's affecting the whole school. So that's my opinion. I don't know if I'm right or wrong, but that's just my opinion.
Mm-hmm. Anybody else? What do you think Jane should do? Somebody mentioned Jane's boss earlier on. I can't remember who it was. Sorry, but I thought it might be Mem, but I didn't. The chances are this type of thing crops up quite a lot, and without calling the drug hotline for the school, or without calling anybody random, there's going to be places and there's going to be ways to put things into action. So the police will have a liaison with the school. The police will have a liaison with the agency that we work for as well, that Jane works for. So it's there might also be counsellors linked with them too, and counsellors in the school as well, possibly. So without going on the New South Wales Police Facebook page and reporting it there, there's ways to get in contact without necessarily doing it the standard way. There's a professional way, is I guess what I'm saying. Yeah, ma'am.
Something that just came into my mind is like quite often there's speakers that go to school to talk about bullying and the effects of it and things like that. So you might be able to incorporate something like that. There might be a program where you can ask organizations that deal with that to visit the school, you know, just as a random. It doesn't have to be the worker necessarily, but just someone that's a third party, and just make the school more aware of it, and the students more aware of it as well.
Definitely.
Possibility.
Okay, we'll leave that there. So, well, almost. There's a couple of things on there that come up in the PowerPoint. So, these two things were vaguely described in the study, in the case study. So we've got informed consent on the one side here, and that's the capacity to understand the nature and consequences of what you're consenting to. Are they legal in adults? Do they understand and agree? So with informed consent, we're asking them if they agree to the must be nearly break time for my brain as well. At the first conversation when they come in, we'll say, okay, everything's private and confidential, unless you're at risk, somebody else is at risk, and then in that we will need to inform nobody specific. We're not going to say we're going to tell her mum if she's going to hurt herself, but we will need to inform somebody. And in that conversation, when we tell her that specifically, then she has to reply with that she understands. That's part of the agreement of her coming into the office in the first place. That anything she tells me, that is going to happen. But then on the other side of that, there's the confidentiality, that we are keeping private anything that she says that doesn't bring in informed consent. So if she's going to a party, and there might be drugs there, then we're not going to report on her, or we might not even report on her at all, because we can't chase down every drug party in the neighborhood. So there's certain things that if it doesn't bring informed consent into it, well, we're just keeping that private and confidential. And then anything that's I was going to say grey area, informed consent's the grey area. Anything that's in the middle that we don't know, we're going to speak to our supervisor and say, look, I'm not quite sure what she's mentioned this. She understands. It's not really, nobody's really in harm's way. Nobody's going to get hurt, but it's really, really worrying. And then quite often it might be bringing in a counsellor, or for us, for our support to figure out what is the best thing to do in that situation. So we've got informed consent and we've got privacy, confidentiality, and disclosure. And Mark was wanting to say something. Go for it, Mark.
Sorry about that. At least she's stating that she was suicidal, and that if she didn't have the
Yes.
cannabis, she'd be wanting to kill herself. Is that like a statement like that you can use to because it's with police, with the authorities, if you go around saying that, then you should sort of put yourself out there to being obviously approached by police, and whoever's in any sort of position has the duty of care to let authorities know that that person's suicidal.
But there is a difference between somebody can say they're suicidal, but that doesn't mean they are. And there's a counsellor or even somebody in the workplace would be able to figure out, just by talking to somebody, is this a cry for help? Is this person wanting help and they're saying they're suicidal, in which case we can get them help anyway for whatever help they need, or are they actually suicidal, and then that's a completely different area of help that they need. So it's trying to figure out which is which, really. Yeah, Lisa, go for it.
But could you get informed consent because she's only 17? So what would you do then?
You would
Even
still
though
get
she
it.
understands.
Yeah, you would still get it. But it would need to be clearly explained that anything, any backup, then it will any backup legally, it's going to fall back on her parents, because
Okay.
they're the legal guardians.
Yeah.
That, I think we looked at that case of that girl who was 18, and she mentioned about domestic violence, and the police or whoever went to her parents and reported it and said, "Hey, your daughter's been complaining about domestic violence." It's like, why would you do that? But in the end, if she's 17, the legal backup is that it's going to fall on her parents, and she needs to know that as a protection for herself.
Okay.
Because if she tells you something, the focus is for her to get help. If she admits to using cannabis and drinking and is sleeping around and putting herself in a lot of harm's way, and then obviously she needs to be referred to somebody that's going to be able to help her. If she refuses, that's when the legal things come into play. That if she's actually speaking to somebody about it and she's consulting with whoever, or she's coming to us in the middle of all that and she's already speaking to a youth drug counsellor, somebody like that, then there's not necessarily a reason to contact the legal guardians. But it's a big problem when she's refusing, she's underage, and there's a legal problem all over the place. Because then if we don't report it, if we don't report something legally, then we're putting ourselves on the line. And we can tell her that as well, easily. Like, if I don't report this legally, then my job, my whole life is on the line because you've told me this legal thing. And she could help us decide who needs to be told and who to go to. Like it's
Okay.
a discussion. No, you can't tell my mum. You can tell my dad, or you can tell my auntie until I tell my mum, or something like that. And it doesn't need to be us that tell her. She could cave in and say, "Okay, I'll tell my mum. I will. I promise." That type of thing. Yes, Chris.
What if she's not consenting to you telling anyone? Because this question also confused me about, she's really going to be quite vulnerable. She's putting herself in harm's way, and then she's going to be vulnerable, passed out drunk or drug affected or whatever. She may get raped or beaten or, overdose or, so I mean, what would you do then? I mean, and again, remembering that she is 17 years old, and what if she's not consenting to you letting anyone know that can make sure that she's safe? What would you do then? Would you call the police or?
I'd call my supervisor, my boss.
Yeah. Yeah.
Because
that's
in the end,
what I would do first. But I mean, what would they do?
They would be very skilled in many ways in getting her to see a little bit of the other side of the story. Maybe then the boss might bring the counselor in, and a 10-minute chat with us might then develop into the boss coming in, the counselor coming in, and it could go anywhere from there, really. But it's not emotional blackmail, but it's literally facts saying, look, I have to tell somebody legally, otherwise I'm going to get prosecuted. And
to cover yourself.
Yeah. Like, please, Muella, I have to tell somebody. Who are we going to tell? Because if I don't, then I'm in a lot of trouble. So who can we tell?
Yeah.
It's like,
that's a good way of putting it. Yeah.
It's difficult. All right. So where are we? It's frozen. So that must mean it's break time. All right. Yeah, we'll come back at 8:10. So that's the task. So who wants to start?
Get a big screen. Yeah, well, we were discussing what our obligations are, and we saw the obligations as providing best service possible to the client. Also, respecting their privacy and confidentiality. As far as our responsibilities, what we expect, our rights is a right to a safe environment, a right to resources and learning that we can do our jobs, a right to have a reporting to a higher authority, and the right to have that reporting followed through by those the higher authorities as well. I'm not sure if there's anything else I missed.
Oh, it's good. Anybody else got anything else? Yeah, go on, Nicole.
We just talked about like working within the job description and the guidelines of the agency that you work for, making sure that you maintain professional relationships, so not seeing any clients outside of work, accepting gifts, giving your personal information to them, phone numbers and stuff like that, but make sure that you're giving support and education and stuff. And then we also talked about like responsibilities to ourselves as workers. So making sure that we are practicing self-care, especially when you're hearing traumatic information, stories, sometimes it can be triggering. So knowing yourself where to seek support, or knowing that like you can go to somebody more senior than you. So yeah, we're sort of looked at it from that point of view as well, because we're also human and traumatic stuff affects you as well.
Right. Definitely. Anybody else before we? There's one more group. Who was it? Go on, Lisa. Yeah.
I was in with Nicole and
Oh.
Mark, and we also talked about following the organisation's policies and procedures. Because
Yeah.
each organisation has different ones, and then the legal and ethical responsibilities and stuff like that.
Yeah. Yeah. Excuse me. I think everybody's jumped on the responsibilities like perfectly. I think everybody got straight to that. But with rights for us as community workers, we have rights as well. And Colin and Nicole have mentioned both of these things. Like we have a right of, yeah, not just safety, not just a safe workplace, but how that's the policy, but the procedures of having a safe workplace mean that like AMBOs and ED workers and nurses, they have a right to a safe workplace, and they're one of the most dangerous jobs. So there's certain procedures that we would have in place in certain agencies where it's going to make sure that we are working in a safe workplace. So when you've got an office, and you've got somebody coming in, the person who sits near the door is not the client. So when you've got an agency, when you work for an agency and you work for a service or a charity, we are the one that sits next to the door because the client has come in to see us. And if we are damaged or hurt or there's a problem for us, then we can't help anybody else. So we've got to make sure that we are looked after primarily, more importantly than the client, because we're protecting ourselves. We might have an alarm or a pull cord an alarm button on a neck that remotely contacts somebody else, because we have a right to be safe. Nicole mentioned we might have somebody to talk to. We should have somebody to talk to, yeah. Whether it's our supervisor, whether it's a lot of places do clinical supervision where it's a requirement of everybody in the service that they all go and see a psychologist for a debrief maybe once a month. And you can bring up, it's only related to work, but you can bring up literally anything that affected us in the past month, because you could be literally on a roll through the day and you're working with somebody and somebody's come in to tell you that they've had a great week and the relationship with the husband is heaps better, and then somebody else comes in and tells you that family is just working really, really well now, and then somebody else comes in and says they've reduced the heroin and they're not feeling in danger anymore, and then the last person in the day comes in and tells you that they were sexually abused 20 years ago and burst into tears. Like, how do we then deal with that? It's not easy. but that's the job, and that's what happens. You're cruising, and your day's flying, and it's great, and then suddenly the worst thing happens, and that's the reality of it. So we have to go somewhere to look after ourselves. Which means, actually, this is a tangent, which means we have to know how to look after ourselves. If we don't know how to look after ourselves in the first place, then that is an issue. And obviously, people learn how to look after themselves, but that's a skill, and it's something that we have to go through. So when on the housekeeping thing at the beginning of those sessions, you've got to look after yourself. You've got to find ways to look after yourself. It might be research. You might have to research ways to look after yourself. The amount of women that like a bubble bath at the end of the night, maybe it works for guys as well. I don't know. I haven't a clue. But how do you look after yourself? Because there will be times when you'll need to do it in the workplace. All right, that was a bit of a rant. So yes, ma'am, go for it.
I've actually got a question for you, because
Yeah.
we discussed this a little bit. As far as rights and responsibilities, I remember in previous sessions that we've done, we've discussed about as a worker, it's up to you how much you want to identify with someone as well about your own experience. So you could always empathize with someone, and that could be
Yeah.
also a way of reducing harm to yourself as well, if you choose to do so, because you're identifying with someone and you can relate and you can take something away from that. So you look for the similarities, not the differences, and try to be. I'm not, as I said, it's as a worker. If I was a worker and I felt the need that there was someone that might benefit from something that I experienced, where I wouldn't tell them what to do, but this is what I've experienced, what my
Yeah.
coping mechanisms were, I would indulge in that, but
Yeah.
then again, that comes down to the policies and procedures of where you're working at and who you're working for and what, and so it's a bit of a gray area in that respect, but we do
Yeah.
have that. I don't know, that's the question. What do you think about that? Like, is that something that we could be able to do?
It is. And there's, like you said, it's a grey area because there's a big breadth of some people don't some people divulge nothing, and it's like, and the worker in the service, it's like they're a robot. You could replace them with a robot because they don't give anything of themselves, because they're guarded. They're so guarded that you don't. It's just a face, and that's not what the community service work's all about. We're working. It's people working with people. But then on the other extreme, you've got people that are just oversharers, and they'll just share too much. It's you got to, like with the rant, you got to protect yourself primarily, and that's protecting personal information. But if you feel it's necessary to help somebody by personal information, then be careful, but maybe speak to your boss about sharing it first. But it helps. It does help when somebody can see that you're not a robot or a faceless person just sat behind a desk. Yeah. Because obviously there's telephone numbers, addresses that don't get given out. But then some clients might be a little bit more forward, and they might ask, "Oh, where do you live then? What area do you live in?" Or, "Oh, really? What car do you drive then?" And it just rolls off the tongue. And oh, So what pub do you usually go to then? Where do you, or where do you usually do your shopping? Is they just roll off the tongue, and sometimes you have to stop yourself in actually answering and saying, "Oh, mine's the Subaru outside." It's like, no, just don't give the information away, because you got to protect yourself. All right, let's just look at the last few slides on legislation. Rights and workers of employers, workers and clients. Employers providing agreed services to clients, a safe workplace, comply with legislation and policies, meeting service standards, carrying out tasks and duties. Yeah, great. And that's any employer, anywhere, working with employment legislation. So workers carrying out tasks and duties for work role, meeting legislative and regulatory requirements and service standards, and follow policies and procedures. It's pretty standard, but obviously once you start thinking about it, it gets quite emotional. Rights and responsibilities of employers, workers, and clients. Receive services provided by the organization. Be treated with respect. Have access to complaints and appeals procedures, and have personal information held in confidence. It's not much, but it's a heck of a lot, obviously. Oh, I'm not screen sharing. All right, so here we go. We'll go from there. There we go. So that's the employers. Already read that. And this is the workers. Yeah. And the client. That was where I got to. Receive services, be treated with respect, have access to complaints and appeals procedures, and have personal information held in confidence. It's not a lot, really. The client is coming in, they're wanting some support, they're wanting help with something, and there's not a lot there. Like, it's basic stuff. So, whoops. Key learnings. Let's just go over what we've done. Come on. Okay, it doesn't want to do that. So legislation in AOD. So we looked at the legislation in different territories, legal principles and requirements, and then duty of care. That was the legislation for New South Wales that I was looking at, and then the others is there. So that is the end of that session. That's the first session of, I think it's 3 on provide interventions for people with alcohol and other drugs issues. Okay, I'll stop the recording because that's it.